pushback tonight over provision in the so-called Big Beautiful Bill that could have a huge impact on nursing and healthcare in our valley.
The Department of Education changing the way the federal government views nursing degrees. News 3's Steve Wolford joins us live in studio to explain why this could pose some new financial challenges to anyone considering a career in nursing.
Well, that's right. A lot of that pushback, you guys, is coming from the American Nurses Association. So here's what happened. The U.S. Department of Education now excludes nursing, at least grad level nursing, from its definition of a professional degree. The concern now is it'll put some serious limitations on funding, things like student loans, to help someone become a nurse.
Nurses, physician assistants, occupational therapists, and physical therapists, among many other healthcare professions, are not included as being categorized as a professional degree.
And as a result, Dr. Patricia Salkin, Senior Vice President of Academic Affairs at Touro University, says nursing students seeking those graduate degrees are facing reduced levels of funding for student loans starting next July.
Graduate students will be able to borrow annually just over $20,000, I think $20,500, with a limit of $100,000 lifetime. And that lifetime cap includes any federal student loans that they got as an undergraduate student as well.
While most Americans might view those higher levels of nursing as professions, the Department of Education is changing the guidelines in hopes of reducing tuition costs. The president of the American Nurses Association is among those pushing back. Jennifer Mensik Kennedy issued a statement saying, in part, at a time when healthcare in our country faces historic nurse shortages and rising demands, limiting nurses' access to funding for graduate education threatens the very foundation of patient care. Dr. Salkin agrees.
The potential outcome is devastating for healthcare in this country. So we're going to have situations where only people that are wealthy enough to go to graduate school because they have family financial means will be able to afford to go. That's not going to be representative of the community that needs healthcare services.
So if these guidelines are finalized, they'll take effect next July, but Dr. Salkin and other nursing advocates are hoping there'll be some additional number crunching by the Trump administration and they'll be able to raise the student loan caps. Back to you.
Well, Steve, as you mentioned, nursing makes up the largest sector of the healthcare industry. So why is there extra pressure to attract more nurses?
Well, here I'll give you a couple of examples. The American Council on Aging says more Americans are living past the age of 85 than ever before, and by the year 2030, 5 years from now, there'll be more Americans over the age of 65 than under the age of 15. Wow. That's a lot of people who are going to need some nursing care.
2030.
Right, thanks for reminding me, Steve. You and I are the same age.
I'm sorry.
With our gray hairs. Thanks, Steve. We appreciate it. So in an article on the Education Department's website, it says the department is required to publish the agreed upon language in its proposed rule to the negotiated rulemaking committee. However, it is yet to judge the rulemaking process and may make changes in response to public comments. A government